Good afternoon, Mr. Ahmed. How are you today?
I'm fine, doctor. How are you?
Nice to meet you today after the last visit. So tell me, how are you doing with the medication you've been on?
Well, doctor, first of all, I would like to thank you a lot. Really, a lot. I've been taking the medication for like what, 6 weeks now. I'm feeling much better, much better. All my symptoms are gone. All my symptoms, all my mood swings, all my depressive episodes, all my suicidal thoughts. I'm feeling much better now. So first of all, I would like to thank you.
So happy to hear that.
Thank you, doctor. Well, doctor, I'm here because I need your permission. I consider stopping this medication. How do you feel about that?
So why you want to stop this medication? You think that you're happy now that all the symptoms that you're complaining of that is improving. So why you want to stop it?
Because the symptoms have improved. I'm cured. Yeah, I'm cured. I don't need it.
Okay. But you know the diagnosis that we discussed before already about this bipolar disorder, that we need some medication to control it. And we're happy that we reached this point that all these symptoms that you're complaining of are improving. And this medication is to control the condition more than to cure it. It's not like an infection that you treat with an antibiotic and then you stop. So maybe other side effects that you feeling, tummy pain or any nausea, anything that you feel and you relate to this medication?
Not at all, doctor. No, not at all. I just want to stop it, or I consider stopping it because I'm cured. I don't need it.
So at this time, I have to tell you how this medication are working, because as I tell you, we control these the complaints, and then we need to carry on that. It's not like an acute thing that we are treating and then finish and stop. We need to continue on this medication to keep where we are.
For how long,
is that
doctor?
what you think?
For how long?
Oh, okay, so we will continue and see how the things are going and how you are doing, and then at that time it can be assessed for how long. I can say maybe initially for 6 months at a time, but let's see how things are going. And after that, what do you think about that?
Well, doctor, let me be honest with you. I mean, you've been my doctor for years now.
Yes,
so I'd like to be honest with you. Well, you know the stigma, doctor. The stigma behind psychiatric illnesses and psychiatric medication. I don't want people to think differently of me, doctor. I don't want people to think that I'm crazy or something.
Okay, so I just want to assure you that many of the people who are living around us, they are using this medication, but we don't know. And being a psychiatric, having a psychiatric disease is not, it's like other disease, like other organic disease. You need some medication just to control these symptoms. And the other thing you can use, like telling only the people around you, like your family and your near friends about this medication. You don't need to tell everybody. And then if you don't tell, maybe they don't know, but even if they know, it's not a shame that you have something is treatable. So what do you think about that?
Well, actually, doctor, makes sense. Thank you. That helped a lot. Okay.
Yeah. So let's summarize what we said about you start this medication, and now you are not complaining, you are having no problem with the sleep, aren't you? Or any thoughts of end of life. And we think that better you need to continue on this medication to prevent any other attacks. And you don't need to be shy of such diagnosis or this treatment. And anything you want to ask? Any questions?
No, doctor, that's all. Thanks a lot.
Okay, so you have my number. You know that we're meeting each other for for consultation or any problem. So in case you have any problems, you want to ask any question, you have my number and you can call or can come to my clinic at any time. I will give you some brochures about the medication, the psychiatry, and about your condition. And I can give you some websites that you can hear. And I think maybe you can join the supporting groups with the people who have the same, sharing the same problems, and they are sharing their experiences, and this may help you. And then you see how people, they are having their activities in their lives with the medication, how they are doing. Nice to meet you and have a nice day.
Thank you.